Today we'll be learning about STDs. You'll learn how to prevent yourself from getting one, the consequences of having one, the treatment for them, and the consequences of having one while being pregnant. An STD is an infection transmitted through sexual contact caused by bacteria, viruses, or parasites. STD stands for sexually transmitted disease. An STD is the same thing as an STI, which stands for sexually transmitted infection. All right, here are some facts about STDs. Every year, there are an estimated 376 million new infections. That means 376 million new people get an STD. 65.5% of Americans have unprotected sex, and unprotected sex leads to STDs. There are more than 30 types of STDs. The most common STDs are chlamydia, gonorrhea, syphilis, and trichomoniasis. What are the consequences of STDs? Well, some STDs, like HPV, can cause cancer. Hepatitis B, herpes, HIV, and HPV are incurable, which means once you have them, you can't get rid of them. And there's already a stigma around STDs, so you really don't want to have one. There are so many dangers of having an STD while pregnant. First, complications for the baby. They can have eye infections, they can even be blind, they can have blood infections, brain damage, deafness, liver disease. The STD can be passed on to the baby. And then the complications for the mother. There's a higher risk of miscarriage, premature delivery, and they may need a C-section so that the STD doesn't spread to the baby as easily. After listening to all these facts about STDs, you may be wondering how you can save yourself from getting an STD. Well, first off, you can use protection during sex. You can avoid sexual intercourse with people that are carrying an STD, and you can educate yourself on the dangers of STDs, because an educated person is better than a clueless person. If you didn't prevent yourself from having an STD, and now you need treatment for one, the first thing they're going to do is put you on antibiotics. If you have an STD, you'll probably be given an antiviral drug. These are for if your STD is incurable, so that you can still have sexual intercourse and not pass it on to other people. But if you're not given an antiviral drug, it's probably best to stay abstinent so that you don't pass it on to anyone else. Thank you for taking the time to educate yourself on STDs. I hope you learned something. See you next time.